Pressure support and SIMV ventilation, part 5. Pressure support and SIMV ventilation, a comprehensive clinical guide to breathe phases, triggering, cycling, dynamic, and hybrid ventilation strategy. First part, focus on pressure support ventilation, understanding the core physiological breathe phases, TLC, T heart trigger, initiated breathe via the effort, pressure and or flow, limit, target pressure maintained during inspiration, and the last cycling terminate inspiration, flow drops to preset threshold. Pressure support, preset and breakdown. Her trigger, the trigger by mechanism, pressure drop -2 centimeter water, flow deflection less than 5 liter per minute. Pressure limit phase. In the limit phase, you set your pressure support positive 10 or positive 15 above beep, and flow cycled here expiratory sensitivity. There is a percentage of expiratory sensitivity. If the flow decreases than 25%, to make the patient to cycling or expiration. Triggering and the flow cycling waveform. Inspiratory flow and cycling mechanism. The pressure trigger initiate the patient negative effort, negative centimeter water or flow deflection 5 liter per minute. Pressure support target, rapid square pressure rise and maintain throughout the inspiration. Declaring flow pattern, the lungs as the lungs fill inspiratory flow naturally decay. And expiratory cycling, expiratory triggering sensitivity. In this time, when the patient flow decay to preset percentage 25%, in this time of the peak flow, the patient try cycling and to start expiration. Here, the flow decreasing. If decreased to 25%, the patient will try to start to expiration. Here in the clinical peer, if they need higher, if you set higher ETS percentage 40%, in this time you short time inspiratory. If in COPD patient, if lower ETS like 10%, extend time inspiratory for restrictive lung strategy. Lung protective strategy, the same as before, to tidal volume less than or equal 8 ml per kg per predicted body weight to prevent volumetrauma, alveolar overdistension, pressure target B plateau pressure less than 30, to maintain driving pressure less than 15, initial clinical rules, adjust the target pressure support level strictly to avoid exceeding tidal volume 8 ml per predicted body weight during spontaneous breathing. Pressure support clinical parameter setting. You can set trigger here sensitivity -2 centimeter water 5 liter per minute, and the limit here 10 centimeter until 15 centimeter above beep inspiratory pressure support level, and cycling sensitivity expiratory trigger ETS 25% peak inspiratory flow. Part 2, synchronize intermittent mandatory ventilation. Combine guaranteed mandatory breath with pressure support spontaneous breathing window. There is time window with synchronization, divided time into repeating window based on the set respiratory rate to guarantee minimal ventilation. Hybrid breath integration. This integrate mandatory and there is breathes maybe volume and pressure and spontaneous breathing. And SIMV or synchronize. You can set the patient pressure support is a share between two modes. You can choose volume or pressure as you need. For example, volume control with pressure support. Patient here tidal volume 500, your pressure support 15 centimeter water during spontaneous breathing. You can set it here 3 cycle. Every 20 minutes, you give the patient cycle, even mandatory or assist, like this. Time window 20 seconds here, and time window 20 seconds here, time window 20 seconds here. How many cycles you give the patient? Respiratory assist 1 cycle here, and mandatory 1 cycle here, and assist here 1 cycle. Between every cycle, yani here, if you give assist in the wind 1, spontaneous by pressure support 15. The patient didn't take any breath, the ventilator deliver mandatory breath. And then the patient assist breathe. After that, you have pressure support, spontaneous breathing. In the SIMV, pressure control with pressure control support, the same 3 window. But here you set pressure control 15 centimeter water and the pressure support 15 centimeter water. Time inspiratory is the same, 1 second. And the set rate 3 cycle, 3 beats per minute, or 3 respiration per minute. Every cycle will initiate it after 20 seconds. Mandatory breeze delivers the pressure target, pressure supports 15 centimeter and fixed time inspiratory. Assisted breeze, pressure triggered mandatory breeze within the synchronized window. And spontaneous breeze, outside synchronization window, patient breathes spontaneously with pressure support 15. Decelerating flow profile. Both mandatory pressure controlled breaths and spontaneous pressure support breaths display decelerating inspiratory flow curve. Like this, the patient have SIMV mode with pressure support. If you put SIMV with the volume control, here the volume control mandatory and assist by volume control, spontaneous by pressure support. If you put here the patient SIMV pressure control, the mandatory breathe and assisted breathe by pressure control and spontaneous by pressure support. Volume control versus pressure control targets. Volume control here, pressure control here. Ventilator variables, ventilator control the flow, ventilator control the pressure. Flow profile here square, constant, decelerating. The pressure control here decelerating. Delivered tidal volume constant, variable in the pressure support or pressure control. Deliver airway pressure, variable in the volume and constant in the pressure control. Clinical takeaways and summary. You must be know as before any mode TLC, trigger limit cycle, and the troubleshoot of desynchrony. Lung protective less than or equal 8 ml per predictable weight, plateau less than 30, driving pressure less than 15. Last thing, you must be know SIMV flexibility. Use SIMV for guaranteed backup ventilation while allowing spontaneous breathing by pressure support. Thank you.